Smart Medicine, health information for life. Brought to you by CHRISTUS St. Cabrini Hospital.
Dennis Flynn joins us today, and we want to talk about something that can kill. It's called sepsis. What is it?
Sepsis is your body's exaggerated and out of proportion response to an infection. You may feel bad for a couple of days, you may take antibiotics, but normally your body does a good job of fighting off an infection. Sometimes your immune system doesn't respond appropriately. It turns on itself, and then your entire body becomes impacted by the fight against the infection.
What do we look for?
Only a small percentage of patients who have an infection actually become septic, but when they do, it is an emergency. An elevated heart rate, elevated respiratory rate, low blood pressure, confusion, excessive sleepiness, excessive tiredness. When you start to see those symptoms in a patient with an infection, it's time to seek medical help.
And we're talking about folks with UTIs, folks with pneumonia, folks with injuries.
Any infection can bring on sepsis, but the most common infections that bring on sepsis are bacterial, usually in the urinary tract system, the respiratory system, or a skin infection. One of those types of infections typically bring on sepsis.
But we want you to know how serious this is.
Sepsis starts off slowly, and it can be stopped in the beginning with IV antibiotics. But once it progresses, your blood pressure starts to drop, you're no longer perfusing your organs, you go into organ failure, eventually you're going to go into septic shock if it's not treated quickly. And the mortality rate for septic shock is 40%.
What's going to happen here?
We're going to call it code sepsis. We're going to get immediate lab values. We're going to start IV antibiotics, and we're going to closely monitor that patient to make sure that we have performed everything that we need to do.
Smart Medicine, health information for life. Brought to you by CHRISTUS St. Cabrini Hospital.